Testing, 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 testing. Morning.
Hey, how's it going?
Doing well. How are you? Morning, Lavinia.
Good morning. Looks like you're there all by yourself.
Yeah, for the moment, it was kind of dark and quiet when I got in, but Josie's gonna be joining in just a second. I think she's making some coffee. Did you have a nice long weekend?
I'm exhausted.
Yeah. Eventful, huh?
Mhm. Yeah, no, we're just doing a lot of work around the house, so that took a lot of work.
Yeah. Awesome.
Worked in the garden.
Yeah. Same. Hey, Krista, good morning.
Everyone have a nice long weekend.
Yeah. Enjoyed some sunshine.
I know. It was like, yay, sun.
Like Annie's joined. Hi, Annie. Good morning. For more folks to filter in here. Hey. Finally.
Good job. It's always an adventure.
Yeah, this room's a lot easier than the other one.
Yeah.
Hey Naomi. Hey Dr. Chowdhury. The folks are popping in here. See Dr. Castillo, welcome.
Good morning.
Give it just a couple more minutes for folks to pop on. Morning, everybody. We're just waiting for more folks to join on here and then we'll get started. Hey, Dr.
Good morning.
Bruce.
Good morning, everyone. I'm checking my audio.
It's
Can you
got a
hear me?
little bit of an echo.
Okay, great. Thank you. Sorry about that. Corrected it.
Thanks, Dr. Chowdhury. You see Noel's joined. Dr. Carroll, good morning. Dr. King, welcome. Dr. Shannon. Looks like we've got a good group of folks today. We'll give it just another moment for folks to join.
Jamal, did you want people putting their name and and their organization in the chat, or are you just going to monitor on your end?
Yeah, why don't we, I think we can start off with the quick attendance. So I'll just sort of call out folks' names, and if folks could just chime in here or feel free to drop your name in chat, that would be great. So one moment here, I'll pull up our roster. Okay. Dr. Sellers.
Here.
Naomi.
Here.
Dr. Rajani. Not here yet. Dr. Carroll. I thought I saw her on earlier. Okay, maybe she'll pop back on in a moment. Dr. Teshador.
Here.
Awesome. Dr. Chowdhury.
Good morning here.
Dr. King.
I'm here.
Annie. Okay, I see Annie's on mute, but she's here. Dr. Williams. Dr. Castillo.
Here. Good morning.
Okay, Phil. Is Phil here? Not seeing Phil. Lavinia.
Here.
It's here. Alicia Calthorpe. Dr. Hatler.
Here.
Russ Huffman. And Jody Peterson.
Here.
Hey, Jody. Prashanthi. Dr. German.
Good morning, everybody.
Good morning. Dr. Rasmussen.
Good morning.
Yeah, awesome. Dr. Fraser. And Krista.
Good morning. I'm here.
Awesome.
Alicia just joined.
And I see Alicia just joined. So Dr. Bruce, I think we're good to go with a voting quorum.
All right. Hey, thank you, everybody. We know that it's going to be a little different, but that is exactly what Jamal is hinting at. We are trying to become a voting group that is action oriented this year. Before we start, we do want to recognize that this May 28th meeting that we are, I believe from here on out, we need to recognize that we are open to the public. We are open for public comment in the early parts of our meetings. Do we have any member announcements from anybody? This is usually the silent part where I get to sit here and imagine what I should have prepared to make up as a poll or joke, but you know what? Just not there today. So is there any member announcements from anybody? All right. Well, and we do want to open it up to let the public know that we are open for public comment for a short duration. And that it looks like we have no public comment today. Boy, Jamal, I am worried we are just going to fly for the first half an hour is going to turn into 20 minutes, which may or may not be a bad thing. So, all right. If we've got no other member announcements or public comments, we would like to continue on so that way we can discuss the CAP charter amendments. Things that we realized when looking through the CAP charter was that there was some things that would inhibit us. So we wanted to enhance that charter so that we could be even more action oriented over here at the CAP. Jamal, I can certainly review the changes, but maybe you want to give them some background of what you realized when looking through the charter.
Yeah, thanks, Bruce. So couple additional changes here since we last discussed the charter in April. And this is really around, especially as our shared savings process gets up and running, this is going to ensure that we're able to move forward a little bit more efficiently and conduct some business in between meetings as quality initiatives are sort of brought forward to the full body of CAP. So the primary amendments that we're proposing here are creating so adding the capability for the CAP itself to add members to this body, ensuring that members are completing the conflict of interest training and attestation form on an annual basis. And then I think really the key thing here is adding a section stating that CAP may initiate email and electronic means to carry out votes in between meetings. So these three amendments were included in a red line version of the charter that was sent out to folks yesterday. So that's effectively what's being proposed here, which I think will ensure that we're able to carry out business a little bit more efficiently and timely as we move forward.
This
Jamal?
is Manu. I'm sorry. Go ahead, Dr. Sellers.
No, go ahead, Manu.
I had a question on essentially the integration and connection that the board will still retain around 5.1. While I understand the intent to be more nimble and to pivot, I also want to ensure that everything that we are executing and voting on and moving forward with, the board is intimately familiar and at least in idea or in philosophy is committed to what we're putting forward.
Yeah.
Thanks, Manu, for that. So we, as it relates to shared savings investments, we'll be updating the board quarterly on all the investment activity that's happening across the Health Council. So that'll include initiatives that CAP is funding through your process, which will be presented to the board next week for review and approval. And then on top of that, Jamal will also be presenting a dashboard update for CAP. So this would include shared savings and all the other work that's happening through CAP to the board on a routine basis as well. So we work really hard to keep those connections between the committees and the board.
Okay, perfect. Thank you for confirming what the checks and balances are. And given what has been shared around Jamal's presentation, can that also be reflexively shared to the cap? Or shared with the
Yeah.
cap?
Yeah,
Okay,
I
perfect.
think- Yeah,
That's
yeah.
certainly part of the plan. Yeah,
Okay, perfect. Thank you. All right, that's all that I have.
great questions, Dr. Chaudhry. All right, Dr. Bruce, shall we open it up for further discussion or move
Yeah,
forward?
I would, that's what I would say right now. Do we have any other questions really currently related to this CAP charter amendments? If there are no, then I would put it before the CAP that we might vote on this.
There's a hand up.
Oh, I have
Sorry.
a hand up.
This is Tony. Just curiosity on section 7.7, in carrying out votes. I assume that requires a quorum, and any other wording around that governance as far as a procedural vote, or could somebody maybe just share a little bit more about that?
Yeah, I'm happy to share a little bit more, Dr. German. So that's correct. That would require at least a voting quorum. I think the specific processes are to be determined. Part of the shared savings process itself has a step ingrained in it that allows every member of the CAP to review quality improvement initiatives that are being proposed to be reviewed, commented on, and effectively voted on within an online form. And so if that's something that I think works well for this group, we can look at expanding it for other CAP business outside of just the shared savings process. But the specific procedures around a specific electronic or email vote, I think is still to be determined at this point.
I've had this come up in a couple other committees and boards. And one thing, I think just some wording, I'm sure this will be worked upon, but if anybody has any questions and requests for it to be an in-present meeting vote, that should be allotted. And then some wording regarding the response time, be a curiosity in email. Some people, sometimes we aren't as great as getting back in a certain time frame. So I think just attention to those details would be wise.
Yeah, great suggestions. And I would think, Bruce, we can certainly look to add that amendment onto the charter, specifically around creating a sort of a time constraint on the vote, and also if any member requests that it's in person, then we move it to the next CAP meeting. So happy to add that in as an additional amendment to the charter to the amendments being proposed here.
Yeah, and it's great. I mean, Tony and Manu, just so you guys know, I mean, this is one of the things that we love about Jamal's experience. He's quite familiar with the procedural and reading through many pages of how do I say it properly, guidelines, and understanding how we are supposed to be. That's how we discover some of these issues with the CAP charter amendment. Do we feel comfortable then if we were to add those timeline not restraints, but timeline guidelines as well? Do we feel comfortable enough voting for this then so we can make these amendments?
Maybe we should do it through email.
It's supposed to be faster, Dr.
That'd
German.
be a good test.
It's perfect timing for it, right?
Well, I think if we can make those amendments, I vote that we move this towards that direction. I'll bring up one of the key points that we realized is that we are looking to add a couple members to CAP. And before it had to all go through the Willamette Health Council board, this will allow us the opportunity to be able to bring people on as a CAP quicker. The 5.1 section, that's one of the big things we realized. And then we also realized the conflict of interest. And then we also wanted to be able to have, to be able to vote in between meetings. So anyway, that's where a lot of these three came from. if we were to add the timeline restraint, can we go ahead and make a vote today? We'd like to get this passed, but I need to know people's comfort levels.
Would anybody like to create a motion to?
Yeah, I'll motion to move forward with
Well-
the suggested changes with the amendments that Dr. German brought up.
But so I'm sorry, this is Russ Huffman. 5.1, it doesn't seem like it lays out how that happens though. I mean, it seems like in order for it to be effective, there has to be it has to be delineated like how that process happens, as opposed to, I mean, like, do we vote them in, or does the chairman, appoint them, or right?
Yeah, that's a great point, Russ, and I think every member that would be considered would be voted in by the full CAP body, and their information such as resume, CV would be shared with the full CAP membership before that vote took place. So happy to sort of add in those guidelines as well to 5.1.
Yeah, I mean, with that addendum, I think it would be fine to vote on that. So, do we want to go back? And whoever was about to make a motion, do you want to do that now? And I'll second you.
Sure, this is Dr. Hattler. A motion to move forward with the proposed changes with the additions of what Dr. German was pointing out earlier, and and Russ Huffman.
All right, and second.
Second. That was Michelle Rasmussen.
Dr. Bruce, you want to see if all are in favor?
All in favor, do we want to say aye or do we want to vote in the chat? Which one are we preferring today? Both?
I think just a verbal aye is
Aye.
probably good.
Aye.
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 I'm
Aye.
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 Opposed?
Aye.
And Carlos, just to confirm, was that opposed to the
Yes, that
amendment?
was I. I'm trying to connect my audio, so yes.
Okay. Aye in favor, right? And then any abstentions? Okay, Dr. Bruce, I think we've got unanimous approval here.
Okay. So looks like we are ready to go ahead and make those changes. And we may have some people to put before the CAP here, I think by next month to vote in. So thank you, everybody. On the more exciting and continued idea of requesting and reviewing processes, we'd like to go to the CAP shared savings request and review process, which we have taken into account your questions from last month. And Jamal has kind of worked it over a little bit, and we discussed it in the shared savings work group, but we do look for, we want to review it with you so we can go ahead and look to get an approval today, so that way we can start being actionable there as well. So if you'll look here, I think I'm going to kind of guide us through this first one here. For those who may not have read through it ahead of time, so I'll go ahead and review this one, and then Jamal will kind of correct me as we're kind of moving along here. So we've kind of created we formed the work group for shared savings, which was recruited from CAP members. And for the last couple months, we've been designing a process which we can, people can request and review, that people can request funds that we might fund them so that we can see community action oriented items go through. and so do remember, as we discussed this, I think this dates all the way back to last year, that it will have positive outcomes in our community, and positively, in fact, impact our medical loss ratios. And so that's kind of the one of the criteria that we had to use. So we are looking today, though, for CAP approval. So that way we might get approval from the Willamette Health Council Board by June 5th. And then we are hoping to go live next month throughout the rest of this year for these processes, wherever you might pronounce that from, in which we will review and fund local QI initiatives. Our ongoing reporting on the performance of CAP investments at CAP board meeting will continue, as well as to the Willamette Health Council Board. So the process that we have in place now, people will submit, and it will have an online request form. I believe Jamal even has an awesome QR code. Is that the QR code that we're going to be utilizing as well, Jamal?
That's the one.
Yes, and I believe reach back. I think Lisa, she helped you to set that up, didn't she?
Yeah, everybody, was really helpful. And,
Yeah, I thought you'd mentioned that Lisa was one. A CAP callback right there.
yeah. Oh, sorry, I was blanking. Yes, Lisa's the QR master around here, so she is amazing.
Yeah, so a CAP callback right there to Lisa for helping to hook us up with a QR code. So people will submit, they'll use an online request form, and it will be available to all Willamette Health Willamette Health Council partners and entities serving the Marion Polk region to request CAP shared savings funds for quality improvement activities. The reason we were being more specific for Marion Polk, because the question did come up, what if it's outside of our region, but these funds are meant to be for the Marion Polk region. The work group review, the CAP shared savings work group will vet each request to ensure that it will positively impact the CCO MLR and drive meaningful, equitable improvements in community health outcomes. And will approve requests for CAP review, and we'll make sure that it follows all guidelines to the best of our knowledge. Upon work group approval, the CAP members will receive an online voting form with details on each shared savings request. CAP members will vote to approve or reject the projects garnering more than 50% of voting CAP members moved to formal approval at the CAP meeting. The CAP approval at the following CAP meeting, the results from the members voting on shared savings requests are presented. CAP will formally motion to approve requests with greater than 50% approval through the online form. Additional discussion on requests as needed. And then the CAP program manager will communicate approval decision with requester, collect needed information for Willamette Health Council grant tracking system, ensures protocols are in place for performance monitoring, and issue requested funds. Quarterly updates on performance to the CAP, which means that there will be follow through with each and every one of them. And please do remember, this is also one of the things that helped us realize conflict of interest, which if you have not watched the video, it's a very easy video to watch. It's available on YouTube. So let's see here, we're on to our next one. So we want to be able to complete the process document included in meeting materials. It will be equity centered. Requesters must indicate how disparities will decrease. We want to be transparency focused. All CAP members will have opportunity to review and shape initiatives. It's designed for rapid innovation, so it'll be tailored to initiatives ready to deliver measurable health outcomes. Now, I will say that don't forget, sometimes it's direct and indirect for those measurable health outcomes, but it will help us with the MLR guidelines, which we were given. And CAP members must recuse from deliberations and voting on initiatives involving their organization. So Jamal, is there anything I'm missing here? I know that I am speaking way too much this meeting, so we're gonna decrease that.
Yeah.
next meeting.
No worries. Always love to hear your voice, Dr. Bruce. But yeah, so there's a full, I think, 8-page process document around the shared savings request and review process that was sent out with meeting materials. So which includes all of the details that of the process that the shared savings work group established. So encourage folks to check that out if you haven't already. One other thing to note here, we wanted to make sure that this process was really transparent and accountable to the full CAP body. So there's sort of a two-step, two opportunities built into that process for the full CAP membership to weigh in on these initiatives. The initial sort of online review. So there's an online form that will be sent, sort of detailing initiatives that pass through the shared savings work group, where on your own time as CAP members, you'll have a chance to look through the details, submit any comments or questions back to the shared savings work group, and ultimately vote on whether you would like to see that initiative move forward. And those garnering 50%, like Dr. Bruce showed on the last slide, will advance to CAP for further discussion and formal approval. So really intended to be transparent and accountable to the full CAP body and garnering the advisory capabilities of this body. That last bullet around sort of conflicts of interest, we do anticipate and encourage members from this body, your organizations, to submit quality improvement initiatives. We know that your organizations play a crucial key roles in the health of Marion and Polk individuals. So we anticipate that several of your organizations will be involved in shared savings requests that come in. And so we've really been intentional in identifying exactly what we need to do to prevent any sorts of conflicts of interest, but ensure that we're investing in those meaningful quality improvement initiatives that your organizations may be a part of. So that's really what that last bullet is in regards to. Other than that, Dr. Bruce, I'll sort of send it back to you for questions and discussion.
So there was a question in the chat that by Caroline Castillo, who asked, is the work group review an iterative process? Will feedback be provided to organizations regarding how to improve the application if not accepted? And an opportunity to reapply? That is a great question.
Yeah. So the way that works out, Dr. Castillo, is instead of a flat denial on many requests, so say that, you know, they meet most of the requirements, but, you know, they need some adjustments here and there, the work group will be discussing those kinds of adjustments. And we do anticipate utilizing sort of a pending process. So if we need to request additional information from the shared savings requester, or, you know, request that they sort of modify their request in some ways. Initiatives, we don't envision that initiatives will outright be denied if it is a great concept that we're hoping, you know, they can make some modifications to or provide some additional information relative to. So that should be somewhat of an iterative process.
Yeah, I would imagine there would be circumstances, for example, I believe we'd said like if, you know, and just so as everybody knows, we reviewed this in, you know, at the last CAP meeting, we reviewed it as the shared saving work group to make sure that it addressed everyone's questions or concerns, both in the CAP as well as in the shared savings work group, to make sure that it would be address everything. The only thing I was going to say, Jamal, that I realized is that we probably also need to add just a time constraint like Tony had mentioned earlier for when we send out the electronic approval requests.
Yeah.
that people will have a certain time frame to get back to us on. That's probably the only thing I saw in what we just discussed.
Sounds great.
Now with that,
Sorry,
Sorry, go ahead.
I have a question. So, rightfully so, there's a lot of initiatives in the governor's office and within OHA around the advancement of physical healthcare transformation, behavioral healthcare transformation, housing, social determinants of health. And with that, oral health only really makes up 5% of the global budget. And so I feel as though that, when we talk about equity as it's listed here, equity is largely considered to be more in alignment with the 2030 Oregon goal of eliminating health inequities. How would this process and setup allow for equitable distribution of funds for any type of oral health initiative, while on the cap the only oral health representations are between Dr. Sellers and myself?
Yeah, that's a great.
Oh, go ahead, Jabal.
Yeah, I was gonna say, so Dr. Chaudhry, we do have Dr. Sellers is representing sort of that oral health perspective on the work group, but we also have a little over 200,000 that is specifically carved out for oral health quality improvement initiatives. It's the only specific carve out within the full $2.2 million that have been allocated. That's not to say that the shared savings fund is limited. Oral health initiatives are limited to that 200,000 that's carved out there, but that's the minimum amount that will be allocated towards oral health initiatives. So just wanted to make that clear that this is a specific allocation that the Health Council felt was of critical importance, much to the point you were making.
Okay, perfect. Thank you for clarifying and recycling that component. Appreciate it.
Absolutely.
All right, was there any other questions that we had? Do we feel comfortable now with this moving to approve the review process? So that way, so that way we can get this moving along.
Make a motion to approve. This is Tony German.
Second, this is Russ Huffman.
All those in favor say aye. Aye.
Aye.
Aye.
Aye.
Aye.
If there are any to be opposed, please indicate a nay. Jamal, I believe we have a voting quorum, and it looks like it is unanimous vote to move forward with this shared savings, the shared savings request and review process.
One quick thing with Dr. Bruce, we'll check if there's any abstentions. Is anybody abstaining as well?
Oh, I did. I asked for abstentions by nays.
Okay, in that case, yeah, you're right. It's awesome.
All right, so I believe my half of the meeting is ready to be to move on. So where are we at now? We've got the Healthy Oregon Program Overview and Strategy Discussion.
We've got Zaira Flores Marin, CCO Director for our region, on the line, and she's ready to take us through the overview and engage in that strategy discussion with the group.
Perfect. Jamal, will you be able to share my slides, or should I be pulling them up myself? Oh, wonderful.
Yeah,
Thank you.
yeah, I've got them here for you.
I'm so glad you have them because I'm working from home today.
No worries.
Hi everyone. For those of you who don't know me, I'm Zaira Flores Marin. I use she, her pronouns, and I'm the CCO Director for the Marion Polk region here at Pacific Source. I have to excuse myself. I'm kind of fighting a cold, so I may have to take a few breaks here to just clear my throat, but hopefully we can get through the presentation without any issues. So one of the things I'm going to talk to you about today is Healthier Oregon Program. I'll do a brief overview on what this is. I'll go over some member demographics. I'll also review some utilization data with you. And then some of the strategies that we're implementing here in the Marion Polk region. And some of these are in partnership with our CBOs and also with the Health Council. And then some opportunities for you all to consider as we continue to move forward in serving this specific population. So next slide. So what's the Healthier Oregon program? This is a new program that was passed in the Oregon legislature, and it gives people the opportunity to apply for the Oregon Health Plan, regardless of their age and also regardless of their immigration status. So these folks are now Oregon Health Plan members, and they have access to full Oregon Health Plan benefits. The one thing to note is that this program is fully funded by state dollars, and so it is something that Oregon did through our local state legislation, and very few states offer coverage such as this. It used to be known as Cover All Kids, and then Cover All People, and now it's Healthier Oregon. So you can go on to the next slide, Jamal. So this is kind of what the membership is looking like. So as of March of 2024, we have about 13,646 members that now receive Oregon Health Plan benefits through the Healthier Oregon program. So we received the biggest influx of membership in July of 2023. So as you can see here, from June 2023 to July 2023, we had about 180% growth. That's because that's when the program expanded to all ages. And so it opened up for individuals between the ages of, I believe it was 25 to 55, who were previously not covered. And so we received a large influx of members in that year and that month. And enrollment continues to grow. It's growing about a 18% growth rate every single month. And so as people continue to hear about this benefit and as they apply, they're joining the Oregon Health Plan to receive much needed health coverage. So for the age demographic for this population, the average age of individuals that are receiving Oregon Health Plan through Healthier Oregon are 37.2 year old. That's the average age, and about 88% are adults, with 12% being children. I don't have the Medicaid data on here, but I do know that for Medicaid, so the full Medicaid federally funded program, the majority of our membership are children. And so there is a difference here where for Oregon Health Plan, the majority are adults. For language, people that are on Oregon Health Plan through Healthier Oregon, about 49.1% are requesting interpreters. So that's nearly 50%. And then the top spoken languages, the top would be Spanish, followed by Russian, actually followed by MAM, and then followed by Russian. For folks that are on the full Medicaid program, about 25% are reporting that they need an interpreter. So that's also really different discrepancies there between what this population needs are versus the full Medicaid population. For folks that are that reported a disability at the time of enrollment, for the Healthier Oregon program, about 44.6% of members reported saying that they live with some sort of a disability. And the top three are difficulty walking or climbing stairs, blind, and then issues with memory or decisions. We believe this number might be a little bit higher, but it really, because some people decline to answer or there are no answers at the time of enrollment. So we do anticipate this probably being a little bit higher than what's being reported. For the primary race and ethnicity for the Healthier Oregon population, the majority, so about 66%, are reporting that they're Hispanic or Latino. And if you dig, we did dig a little bit deeper in this data, and the majority of those that are Hispanic or Latino are reporting that they are Mexican or from Mexican descent. So that is the highest proportion that makes up that 66%. We do have a large proportion that are also no response or non-response. And again, this goes back to, we get this information from enrollment data. So people have the option to not respond or leave the option blank. And so that is, this data could be a little bit higher as well, if these folks did end up reporting any information about their ethnicity or race. We also have folks, and then you can kind of see the breakdown from there. I'll send out an additional report that kind of breaks this down even further, so folks can dig a little bit deeper if this is an area of interest to you all. The other thing that I thought was interesting that I asked analytics to pull for us was a heat map to kind of see like where is the concentration of members that are on the Healthier Oregon program. And so in our community, most of the folks that are on the Oregon Health Plan through this benefit live in North Marion. So that would be the areas of Woodburn, Hubbard, and Jervis. And then you can see there's a high density of population in that dark area in Northeast Salem. And then there's a few others in Monmouth, Independence, and then in Staten. So for utilization, utilization per 1,000 members per year is lower for the Healthier Oregon population in comparison than those that are on full Medicaid OHP plus. So for the emergency department utilization, it's actually lower for the Healthier Oregon population. But I did put a little asterisk there because their risk score is quite similar to our full population, the full Medicaid population. So we do anticipate this number to change as we continue to get additional claims data in, and as we continue to see the usage of this population. For the big, large cohort of adults, they just barely joined our membership at the beginning of July last year. And so we're still continuing to receive utilization and claims data to be able to understand how they're utilizing benefits. So we do anticipate that the emergency department usage may change, and we are tracking that quite closely. We're also seeing that there's significant lower utilization in primary care compared to folks that are on the OHP plus program. And then there's also significant underutilization in behavioral health visits. And this even holds with a behavioral health diagnosis. So Healthier Oregon members who have a behavioral health diagnosis are also utilizing the benefits at a much lower rate than Medicaid members with a behavioral health diagnosis. So what does this mean for our region when it comes to underutilization? Since we are in a risk corridor with this population, the state of Oregon, so the Oregon Health Authority, they give us funds up front to pay for their benefits, and any difference that results, whether we underspend or overspend, there's a difference. We either rebate the money back to the OHA, or the OHA actually rebates money back to us. In this instance, there was an significant underutilization of benefits. And so we are estimating a $33 million rebate to the Oregon Health Authority due to this population not utilizing all of the benefits based on the rate that the OHA set for us, which is a large amount of money. I do want to emphasize that. And so all of the CCOs, including those at Pacific Source, every single one of them is estimating a rebate back to the OHA because we have a pretty large population density. Ours is pretty high. So we're looking at 33 million. So here's a little bit more information on PCP utilization. So as you can see, for older adults 18 and over, there was about 34% utilization. And then for children, about 43%. And then you can kind of see the contrast below. And then some of the top clinics serving this population in our region would be about 40% of the membership that we have is actually being served by Yakima Valley, so the Salud Clinic, and then the Lancaster Medical Health Center. Kaiser Permanente also has about 8% of our membership that's in HOP, and then Legacy Woodburn, and then Northwest Human Services, the West Salem Clinic, has about 3.6% of the membership that's Healthier Oregon. So some of the reported barriers that we're seeing that are being reported by members who call us in, by some of the, I've been to a lot of community groups that are serving this population, and also some of the barriers that are reported by CBOs, is that folks are having a very difficult time understanding their benefits. They're also having challenges locating providers. We've received information about folks having difficulty accessing care, either getting appointments, getting seen, establishing care. There's also a lot of folks that are still utilizing out-of-network providers, which is leading to medical expenses. So they're continuing to receive pretty high medical bills, and we're assisting them in navigating these some of these barriers. Folks also have, as you saw with interpretation needs, there's significant language barriers, transportation challenges, and then just a general lack of trust in the system. This is a population, a lot of folks have been here for many years, but they've never really had access to comprehensive medical care. And so there's still a lack in trust in the system that they're now able to access. Some of the current strategies that we're engaged in is that we have added this as a performance metric for our CCO in 2024, which means that we'll be tracking PCP utilization pretty closely, and we'll be reporting that to the Willamette Health Council, which is also the CCO board. We started doing customer service calls, and so our customer service team, as we receive enrollment data, they are calling our HOP members to make sure to welcome them, go through their benefits and see if they have any questions. Internally, I'm leading a Healthy Oregon work group with staff that are community facing to ensure that we are working through our different member communications and different strategies at the CCO level. We also held a event with the Oregon Health Authority and CBOs back in November to talk about this population, review data, and talk about strategies. Which led to some outcomes. We were able to get a lot of our member-facing materials translated into MOM, which, as you saw, is the second most spoken language in our region. And we've also started reviewing member-facing flyers for translation accuracy. We've been hosting CCO 101 trainings with CBOs that serve this population, as well as providers. We are working with CBOs to make sure that they understand how to contact us and help facilitate member navigation. And we've been receiving a lot of releases of information with CBOs so we can contact them directly. We've been doing staff trainings. I've been on the radio to talk about this new benefit and talk through the ways that folks can contact Pacific Source. And then we also have been really promoting our Pacific Source training. So we have a lot of trainings around translation, interpretation. We have a qualified, we have a training for people to become qualified interpreters that we put on that's pretty effective. And if that's of interest to this group, I'm more than happy to invite Trudy, who oversees that program, and provide additional resources. Next page, please. And then here's a little bit more information on the healthcare interpreter training program. So our program is about a 60-hour training that's approved by the Oregon Health Authority. And we also provide individualized support. So if you have anybody in your clinic who's currently serving as an interpreter, for example, we have a lot of folks that are like front-end staff that also serve as interpreters. So they end up signing up for our program, and once they go through this training and they become healthcare interpreters, they're able to bill us for the hours that they provide. So that's another way of you all providing this benefit, but then also making sure that you're being able to bill for the service that they're providing. There is the person who goes through this training, they are required to have a sponsored organization that has a contract with Pacific Source. So if you work for a clinic who's contracted with us, and that person would be able to be sponsored by that clinic. We do require a $1,100 fee up front. However, this will be reimbursed at the end to make sure that folks are following through and completing the training, because there is a lot of work that goes into it. So we want to make sure that people commit and actually follow through for it. And the link is there. I'll drop it in the chat if you all want to learn more. And I'm always happy to invite Trudy to this meeting. So she can talk more in detail about the program and then also all of the different trainings modules that we have available, many of which come with CEUs for folks that might need that as an additional support. You can go on to the next one since I've already walked through much of these. So a few other strategies that we're working on is that we're exploring the usage of Connect Oregon and Point Click Care to support our providers as well as our community partners in serving this population. We are also looking at having community lunch and learns to really talk about disparities in our community and in public health. That's something that I really want to explore with the Health Council, and there's a few ideas that I've been thinking about, especially around just talking about disparities that specific communities of color might be going through related to health. And we're also looking at increasing our outreach and engagement efforts. So at least for Pacific Source, we've been making sure to, we've been looking at just going out to community events more. We're creating a toolkit for our community partners. We just had some grant funding approved for our community partners. So we are looking at giving out grants to folks similar to the ones that we did for redeterminations to help people, help CBOs and providers maybe get additional outreach. And then we're also looking at launching a radio PSA. So we're working with a local radio station and doing PSAs in Spanish and 6 indigenous languages from Latin America. And we've been doing a lot of work around revising our educational member-facing materials.
And Zaida, we have a question in the chat from Lavinia. She asks, how are you addressing the access to providers barrier that was mentioned?
Yeah, thank you, Lavinia. That's a really big question. I think this kind of really touches on something that we've been seeing even beyond this population. I mean, even with our regular OHP, the OHP plan that's medically funded, access to care has been an issue ongoing. So we do, we have a staff member within our agency that looks at working with workforce development. Her name is Cheryl Cohen, and she's really engaged in that work. We're also just starting to look at maybe using some of the funds that we have available for HOP to look at provider incentives. And that is a conversation that we're starting to lead with our contracting team. But we're also open to additional ideas. I think this is a really big barrier that a lot of folks are experiencing, whether they're in HOP or whether they're enrolled in OHP Plus.
Thanks for that, Lavinia. And I was curious as well, Dr. German, Dr. King, I know that a large segment of the HOP population are served at Yakima Valley and the North Lancaster, Kaiser Permanente. As Zaira mentions, potential incentives, thinking through your engagement with this population, are there considerations that y'all would like to share in terms of what would help increase access for the population served?
Yeah, Jamal, thanks for that question. I'm gonna just jump in here. I had some other questions, and Ms. Flores-Marin, thank you very much. That was excellent, and I think highlighting the great work that Healthier Oregon and what this program is doing is really necessary. I have some. I wonder. I see your email. I may just connect with you afterwards. Have some follow-up questions, not to belabor here at this forum. I think one point I'll highlight is that in a couple of our systems, community health is a turnover is a reality, and that I think primary care is at a shortage, and the lack of robust funding. Although Oregon does a pretty good job, we still are not doing the best of jobs. And so if people can't get into clinic, then they can't utilize that service. And I have some questions regarding that. Actually, do you mind commenting to the effect of the projections? And so the risk corridor was put in place with some anticipation of what that enrollment would be. And so does the 13,000 equate to what we were anticipating for the program in our region?
Yeah, so it's pretty much the funds that we received for this population were kind of in line to what the state has seen usage be for OHP plus. So the risk corridor was really set with that framework in mind. But one of the things that I believe was a big miss is that this population is different, right? Like these are folks that are, a majority of them are undocumented. And so with that, it comes a lot of disparities with that. I think the biggest one is just the lack of trust, or even the lack of knowledge on how to access care. Most of these folks transitioned from CAWAM to OHP via Healthier Oregon. So folks that were in CAWAM, the only way that they were accessing care was through the hospital system, through the emergency department. And so it's definitely, I think the rates were set with the idea that this population would probably be utilizing the system in the similar way that new OHP populations utilize them. But I want to just iterate that the usage is I don't see why. I don't know. I still question why that was done, just because of that additional layer of challenges that this population has around accessing the system because of their migration status. So I feel like part of the rates were set pretty high that we received, which then resulted in a pretty big rebate back because the usage was significantly low.
Yeah, I'm quite worried about the clawback of this program continuing, and hopefully there will be continued growth with it. And so I think attention to that. I will tell you that there have been just a multitude of patients that have been uninsured in our clinic for as long as I've practiced here, over a decade. And now they have Pacific Source, and getting them access. So I had somebody the other day who's had a FIT test for colon cancer screening, it's been positive for a bit, but hasn't been able to get care, and now has Pacific Source and is able to get into definitive specialty care. And there's just so many different examples of that. Jamal, to your question, I think it's a long game is the challenge. Is I need more providers and more staff, and that takes time. Hiring, I think there are a number of programs we could do to support people in outreach. I'd love to probably engage on that off of this call because it's a longer discussion.
Yeah, so I put my email in the chat, Dr. German. Yeah, please go ahead and reach out to me. I've chatted with a few folks at Yakima Valley already, but I think it'd be really great to have a conversation with you and talk more in depth about some of the strategies that we're doing, especially considering that Yakima Valley has about 40% of this population, right? So I think there's might be some engagement that we could do around this, and at least at the CCO end, we're really interested in moving this forward and trying to support our providers as well as the population as best we can. But it's going to be a long game, right? It might take a while for us to actually see folks knowing and learning how to use this benefit.
Yeah, and I think some of the things is direct contact to people, that we've discussed in this forum, our community-based organizations, Radio Poder. I think that's probably where you've been, as flyers, but getting people out directly in point of contact would be great.
All right, we have one more question. We have 2 minutes left, and I also have some updates and announcements. So Krista, I'm going to ask you to make it short. Go ahead.
Super quick. I just wondered if the state changed the rates for these patients for this year, or is it still the same rates and potential underspend?
I don't know if we know yet, Zaira, right?
Yeah, I don't know, Krista, yet. I think we're still kind of waiting on that information to come out from the Oregon Health Authority.
Yeah.
Okay.
We don't know, Krista, the final clawback number quite yet, too. That's still all being finalized.
Yeah, we're for the final clawback, we're going off of just our data that we have around claims and based on where that percentage is compared to what we received up front for the benefits. But we don't know yet until we close our books. And so we're anticipating the clawback to go back to the state sometime at the end of this year.
All right. Thank you so much, Zaira. It looks like you will be getting some emails coming in.
Me
so
too.
look out for
love
those.
to continue this conversation. Thank you all.
Thank you, Zaire.
All right, and I will try and go through everything in 1 minute. Thank you, everybody who has been contributing to the Childhood Healthcare Access Work Group. We will have 2 proposals coming to CAP in the near future. One is around the focus on perinatal lunch and learns for providers and doulas in the region. There's going to be 1 virtual and 1 in-person networking session in the fall, and also outreach and education campaign for home visiting programs. The second proposal will be around school exclusion day, updating the materials for next year, and also trying to start earlier and potentially having an FTE coordinating school exclusion. Then we'll move on to updates and reminders. Please complete and return your conflict of interest form by the 30th of June, please. Also based
I'll
on
just say really quick, Naomi, we've got about, sorry, I'm echoing. We've got about half of members have completed this at this point. So please, 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 send in your attestation form when you get a moment, please.
All right, and then based on some requests earlier this year, on the 25th of June, we will have a session on gun violence prevention efforts in the Salem area that will come to CAP. Also, 25th of June, we will be extending CAP to 90 minutes to have an extra 30 minutes for a HIT discussion. And then in July, the 90 minutes will be extended for input on the new Marion Polk Community Health Assessment. And with that, we will adjourn our meeting for today and we will see everybody next month. Thank you so much for giving us this hour.
Thanks, guys. Great meeting. Bye.
Thank you.
Take
Thank
care.
you. Bye, everyone.
Bye.